Remote patient monitoring is taking some fantastic advances these days because of wireless technology, and Sotera Wireless is one of those companies. It's really one of the leaders in that area. I'm with Gunnar Trommer with Sotera. And Gunnar, tell me about the product that you have here. We have our friend all wired up, but this is all about keeping an eye on patients in the hospital and in external settings.
That is correct. So what we have here is our product Visi Mobile. Visi is short for vital signs, and we monitor all vital signs that currently only get spot checked, meaning measured infrequently, every once in a while, every 4 to 6 hours on a continuous basis, which allows to keep patients safer inside and outside of the hospital.
So what are we looking at here? I see that we have the device hooked up to the patient's wrist and then all kinds of leads set up around their body.
That's right. We have basically two sensors extending from the monitor. One is what we call the thumb sensor. It's an optical sensor. It allows you to measure SpO2 and pulse rate in itself. And then we have another sensor which we call the chest sensor, which gives you ECG, heart rate, respiration rate, temperature. Between the two we measure with a patented algorithm continuous and non-invasive blood pressure. And we also measure motion, posture, position of the patients by means of accelerometers.
And what does all that information tell me as a caregiver?
It basically tells you how well or how bad your patient is doing. So the current standard of care is that patients only get monitored every once in a while, every 4 to 6 hours, as I said. And this means that there are windows of patient risk in between, right? And what you really want to have is a monitor that allows you to have all the information, and those are the core vital signs that I just listed, at all times and anywhere, right? So wireless technology enables me to give access to clinicians to see how not just one patient, which would be the patient that you're currently with, is doing, but all of your patients that you're taking care of.
So if I'm a doctor, if I'm a nurse, whatever practitioner, I do have 24-hour access to this information. Is it archived too, that I can go back and look and see what's happened to my patient over a period of time?
Yes, it is. So we give you the information when you need it, meaning when there is an adverse event or a nearing adverse events, we give you an alert, but we also give you when you want it. So basically you can always go back in time, you can look at really full disclosure, real-time information, be it waveforms, be it trends, be it parameters, so you have all the information at your fingertips wherever you are, thanks to wireless technology.